Hey everybody, James Bardwell here on behalf of Bert Seelman and Results Are Proof. I'm going to take a few minutes and talk about Bert's programs, as well as Bert, and who I am and how I came to know Bert, and the exciting things that are planned for the future. So first off, for the first 15 years or so of my career working, I was a chemical engineer, and I worked in medical devices, pharmaceuticals, worked on a lot of different products, catheters, cutters, uh, antiseptics, and a lot of different things that were put out to help people that were in need of healthcare services. Along the way, I was very ill with testicular cancer and had a few other people that were stricken with some chronic diseases, including cancer. And I made a decision to go back to medical school, and I'm about to graduate as an osteopathic medical physician, and I will be doing my residency in internal medicine. When I was in medical school, or before starting medical school, I met Bert. This was about 4 or 5 years ago, and I learned that his approach to helping people with their health was completely different than anyone I'd ever met. One of his first quotes was the Hippocrates quote, which was, "It is better to know the person that has the disease than to know the type of disease that the person has." And I had heard that quote before, but when Bert said it and then we got to talking, I knew that this conversation was a complete alignment of my beliefs with someone else's on how things could be done to improve people's health. So as we look at the United States, of course across the world, people are sick, they are getting sicker, and the cost structure and the way the entire system works is not functioning optimally. So I think there's three things that I want to really hone in on here with respect to that. The first is, if you can imagine that you or the important people in your life who may be sick, who may be at risk for getting sick, could go and be disease free. If they were stricken with a disease, they could recover quickly. And at the end of our lives, we all look back and say, we wish we had more time. And that is the premise for which these programs, which I'll start as my first point here, are designed by Results Are Proof. They are designed and engineered to look at the entire person and to measure, analyze, and apply concepts that Bert has over 43 years of experience in fitness, nutrition, and helping people with their health. So number one are the programs themselves, based on experience, based on methodology, based on analysis, are bar none the best. Number two, I've got right above me here, it says pre-event. Of course, that is when you break down the word prevention or prevent, it's a pre-event. And that is the second premise in which these programs are built. That anything that can be done in these programs are focused on preventing and doing everything possible to make your body be able to be at its best all the time. And so that the disease is essentially, it's impossible for a disease to find its way into the body when it's working properly and optimally. And I touched on it already, but the third thing that I wanted to talk about is the person. Is that when Bert initially talks to someone, someone will call, they'll write, they'll email, and really, of course, anything that's bothering them in their life with respect to health, how they feel, what's going on, it is immediately kind of the first thing that people want to discuss. And that's really important. Just as important is the entire person, and that's why I drew a circle around the person. It's the physical, it's the emotional, it's the psychological, it's the spiritual. And when you talk to Bert and work with Bert, you're going to be asked to share all of these things at a level that maybe you're not accustomed to if you've worked with anyone else, any type of medical professional. But these are the things that are absolutely at the core of results or proof. Being an upcoming osteopathic practicing physician, as a resident, the osteopathic tenets are body, mind, and spirit. Same concept, the entire person. And that is really the basis for everything that can be done when you work with someone to optimize and to better their health. So in short, I really think between the programs based on experience, based on engineering, based on measurement, coupled with the targeting of trying to prevent things from happening, from improving people's health to a state that preventive medicine becomes the way in which we practice. And third, this is all built around you as the whole person. There is no other way to go about practicing in terms of helping people with their health. And in the end, results are proof, and Bert Seelman are focused on sharing, on communicating and collaborating far and wide across communities with medical professionals, and for anyone that wants to work in this way to help themselves, their loved ones, and anyone important or anyone they know. These are the basis for results or proof, Bert Seelman. And my name is James Bardwell. I look forward to speaking again in the future. Thank you.